And as you know, yesterday the province announced the stay-at-home order for Hamilton will end next Tuesday, February the 16th. We do not yet know what stage of the province's reopening plan, gray, red, orange, yellow, or green, that Hamilton will be in when we do get our order lifted. Until then, please continue to do your part to limit the spread of COVID-19 by avoiding unnecessary contact and stay within those you live with in your household, including family, friends, and coworkers. So thank you for that continuing effort. It has had some impact, and certainly the numbers aren't low, but they're certainly improving, and that Dr. Richardson will share some of that information with you. This coming Monday is Family Day, so remember a reminder that it is illegal to gather with those outside your household indoors while we remain under the stay-at-home order, and that will certainly still exist on Monday. Family Day is an important holiday for many of us, but like most holidays we've experienced this year, this is not the time to let our guards down or disobey the public health measures. There are many winter in Hamilton activities for residents to do safely this Family Day weekend, such as ice skating, taking a walk or hike on the trails, borrowing some of our snowshoeing or Nordic pole equipment at Kings Forest Golf Course is another. So some reminders for when you are participating in the outdoor activities: keep your distance from those you don't live with. If spaces are crowded, come back later or choose a different action or location. Wear a mask when indoors or when physical distancing is not possible outdoors. Bring a hand sanitizer to clean your hands frequently, especially after touching rental equipment, commonly touched surfaces, or before or after eating. And carpool only with those you live with at the moment. So find more at hamilton.ca/winter. And last week, the province clarified that they will be officially allowing pet grooming services to reopen on February the 4th. So we are thankful that the province provided some clarity on this issue. Certainly there was some unclarity across the province, and certainly that clarity has helped all those that have pets in our community have a good understanding of what's available to them and to their pets. So the details of that will certainly be available, and I'm sure that Paul will speak to that in a few minutes. And lastly, I will remind everyone to not leave your homes unless it is for essential purposes or activities. Those essentials include going to the grocery store or to the pharmacy for your medical needs, assessing healthcare services again, exercising, or for work where the work cannot be done remotely. So COVID-19 virus is still very active in our community, so please continue to adhere to the public health recommendations. Your actions are, let me assure you, they are making a difference. As difficult as it is, and as much sacrifices that is being made in the broader community, they are making a difference, and we ask you to continue on. Now I'm going to turn it over to our Emergency Director, Paul Johnson, please. Paul.
Thanks very much, Mr. Mayor. And as you've mentioned, things will begin to change potentially for Hamilton next week on Tuesday, February 16th, as we go back into the response framework, which, as many people know, is affectionately known as the color categories. And I just want to reiterate what the mayor has said, that up until that point, nothing changes. The stay-at-home order is in place, and our enforcement will be to the lockdown and the stay-at-home order provisions that are in place, and they will not be changed and they will not be relaxed until such time as we hit next Tuesday and know what category we will be going into. That category has not yet been determined. That will happen as we move through the week, is our anticipation. And until such time, we won't be projecting or guessing in terms of what that will look like. And I understand that businesses that feel that are trying to guess where we're in terms of getting themselves ready for what might happen next week, I would ask you just to hang in there. And over the next few days, we expect we will get that word, and then we'll be able to share what the restrictions will look like for Hamiltonians coming into Tuesday of next week. And there have been some changes to the categories, all of them. And so we're reviewing those as an emergency operations center, and we'll provide some clarity, both once we know what color category we are in, and we'll provide clarity for the community on some of the changes that may have taken place, and give some advice in terms of what people need to be prepared for coming next week. But as we head through this week, and in particular into a holiday weekend, we need to remember that that stay-at-home order and all of the lockdown provisions that are in place remain in place, and that will be our enforcement regime. The mayor mentioned the pet grooming situation. We're pleased to see that. We ask the pet groomers are providing services only necessary to prevent an animal from requiring foreseeable and reasonably imminent veterinary care. So again, if our pet grooming folks in the community for the next little bit can just ensure that they're doing that when this is really necessary for the pets, rather than opening this wide up as more of the cosmetic pieces in place. From an HSR perspective, just a request for regular users, well, all users of our HSR, but the regular users can help inform those that are infrequent users of our HSR system that we would really like people to exit through the rear doors of our buses. And of course, we're not going back to the entrance and exit through the rear doors. It's entrance through the front doors. But in terms of exiting the bus, it just keeps things from being clustered and in the front area of the bus. As you can imagine, at certain stops, there are a large number of people, and at some of the hubs for transfers and things, there are large numbers of people that need to exit. And exiting through the rear helps keep people from clustering, particularly around our transit operators. So wear your masks when you're using our transit system, please, please, please. And exiting through the rear doors will continue to make sure that we keep our transit system as safe as possible for those in our community who need it. And again, this is a critical transportation link for essential workers in our community, so we want to make sure that that's there. Those that are anticipating and looking forward to and thinking about in any way special events throughout the year and need to come to the city for some of those special event permits, just a reminder that at this stage, our encouragement is for people to continue to look at how they can do things in modified ways and virtual ways. And in fact, we're not going to be approving and reviewing in-person events in the next that are potentially to occur in the next few months. But we know that people want to book dates sometimes, and look at ways that they can do things. And so, if you want to put in your application for a special event, absolutely hold that date, hold that venue. We know that you don't know, and we don't know right now what the requirements might be. But I do want to let you know that if you are feeling that you think that more people will be able to attend events in the foreseeable future, our answer back to you will be, we're not reviewing it for that. We will look at virtual events. We will look at those drive-through events, the things that are allowed right now. But at this particular moment, we're not going to spend time as staff reviewing in-person events for large-scale events, because there is no indication yet as to when that might happen, and we're going to wait for that to come forward. But we do know that people like to get their events in calendars. We do know that people like to book venues, because again, we don't know what will happen as this year goes on. So we encourage that, but just be comfortable with our staff letting you know that we're not going to talk about in-person events at this particular moment in time. The mayor's covered Family Day, so all the same rules apply this Family Day. You're getting together with people in your own household. If you're single, or if you're a single parent, then the exclusive household that you've been perhaps partnering up with throughout the stay-at-home order absolutely can connect there as you have been. But for everybody else, there are no parties, there are no gatherings. And from an enforcement perspective, what we're seeing is more of our charges and more of our fines are being laid for gatherings. In fact, if you look at our website, only one business is new on that website this week. It's actually it's actually an offense under our local bylaw around face covering, and not asking people who are not wearing face coverings to leave the establishment. So we're seeing much more of these things happen in public gatherings and in private gatherings. And the answer to that is, of course, these are not allowed. We will be out there enforcing when we get calls that people feel that there are gatherings occurring, and we will be enforcing throughout the weekend as well. So, to the mayor's point, enjoy the things that you can, and get outside in particular, and enjoy some of those outdoor activities. And the last thing I'll say to those who have been using very well our ice rinks, our outdoor ice rinks. Some of those ice rinks, as people know, are operated by community volunteers. They do a great job. Well, in those sites, we have old signs, signs that have been up for years, that say that you can play hockey on these outdoor rinks. We have signs in the pandemic that say, of course, you can't. Respect the signs that are there for the pandemic. We say you can't. Playing of hockey and things brings people together too close. That's not what they're there for. So we don't want anyone playing hockey on the ice rinks. And many people are saying, yeah, but the sign over there says that we can. And of course, that sign has been there from other years. We're not going to take all those signs down. We're not going to cover them up. We do have the temporary signage in place. And the volunteers, quite frankly, give them a break a little bit. When they say, hey, you shouldn't be doing that, these are volunteers that each year put their time and energy and effort in partnership with the city to get some additional outdoor ice rinks up and running. We thank them for that work, and just please, don't take them on. If they're giving you instructions, it's because that's the instructions that we need to follow through the pandemic, regardless of what our traditional signs may say in the park. So with that, I'll pass things over to Dr. Richardson.
Thanks very much, Paul. So I'm going to go through the cases numbers as we usually do. So starting off with 9,601 cases total in Hamilton reported as of today, and that's 13 new cases from yesterday. I'm going to come back to that in just a minute. We have 442 active cases, 269 dead date, with just one death reported today. We're currently reporting a total of 25 local outbreaks on our website and no new outbreaks to report as of today. As always, you can find details about the outbreaks and other information on our website. And coming back to that 13 new cases today, so I know it might seem quite remarkable. It's very important, though, that you keep an eye on the 7-day average of cases instead of the fluctuations of the daily report to see where we're sitting at. Our weekly incidence per 100,000 right now is at 61, and our 7-day rolling average of cases per day is 53. Our weekly reproductive rate does also continue to fluctuate. Last week it was at 0.98. This week it's at 0.78. So that continues to go up and down a little bit. So these, of course, are some of the metrics that are going to be used to determine where we fall when we move to the provincial COVID-19 framework on February the 16th. But as both Paul and the Mayor have said, we do not know where we are going to fall in that framework at this point. We will be following the numbers. We will participate in the discussions with the province when they're offered. And the decision ultimately, as we know, is in the hands of the province and will be there by the end of the week. So I will say it does feel rather quick to move back into the framework. For us here in Hamilton, yes, our numbers have been declining. We have come down from a peak of 164 weekly incidents. And for us here, that has been a slow and steady decline. Some places have seen a bit more of a sharp decline. And of course, this was the point on the way up on the other side at around the 65 case mark where we were really getting quite concerned as things were taking off. So it really just feels we're coming back down to that point now. So we're going to be watching those numbers very closely over the week. As well, for us in public health services, we have just gotten back to being able to do case management and contact tracing on all of our cases. So that is really good news, but at the same time, we're just there. And we know with schools reopening that there are going to be cases there and that there will be additional work managing the cases that do occur in that setting. And so that is going to put some strain on the resources. We also know that the UK variant is now circulating in the province. It is believed to have community spread, as we heard from Public Health Ontario last week. And we've seen countries that have had another wave that's associated with the emergence of that variant. The other thing for us, of course, is getting the vaccine out, and we're going to work hard to get that vaccine out as soon as it is available. But we do have concerns that as of yet, there's not been enough vaccines to get our most vulnerable populations, to get those who are at highest risk of dying vaccinated. And of course, we know that risk rises sharply with age. So if it's going to be, if we're going to be opening up further, it is critical that everybody continues to be responsible in terms of following public health measures and taking the advice that is there, especially for this week before we get to that point, but even beyond. And to remember that there is this emergency brake provision that the province has discussed and would be putting in place in order to return to higher level of restrictions if we are beginning to see numbers go back up. So that's that's a really important part of any piece of moving forward. So in the meantime, as I said, vital that we continue to be cautious and vigilant. We don't let our guards down, continue to follow public health measures, not to gather with others outside of your immediate household, to stay home as much as possible, to wear your mask, wash your hands if you do need to leave the house. And as we've said all along, if you aren't feeling well, please stay home. Again, cannot stress this enough. We should still all be concerned, especially with the new variants around us. We know that they are more transmissible, and so adhering to these practices is more vital than ever. It's also, I wanted to give a bit of an update around vaccines. So as of the end of day yesterday, we've completed a total of 20,658 vaccine dose administrations. 6,256 of those are through our mobile site that goes out to long-term care homes and high-risk retirement homes at this point. And we still have the 14,402 at the fixed site clinic. As you know, it's been out of service while we've been waiting through this provincial period with less vaccine available. So throughout this week, the mobile clinic will continue to provide second doses of vaccine to residents in long-term care and high-risk retirement homes within the original timelines. So 21 to 27 days for the Pfizer vaccine, 28 days for Moderna. As of now, our planned end date for the mobile vaccination clinic to finish all those long-term care homes and high-risk retirement homes is February the 21st. Of course, based on the logistics and our vaccine availability, as we work together in tandem with all of the communities across Ontario to vaccinate all of those in these settings, that is subject to change. As I said, the fixed site at Hamilton Health Sciences that had been vaccinating the staff of long-term care and high-risk retirement homes, along with essential caregivers and other high-risk healthcare workers, was paused due to vaccine availability. It is due to restart tomorrow, February 10th, and will be distributing second doses within the new 35 to 42-day timeline. So on the data front, we have begun posting preliminary COVID-19 vaccine data at our website, www.hamilton.ca/coronavirus. This data includes the total doses administered and total doses administered by clinic site. As we continue to move through the vaccine administration and continue to hopefully receive more ability to pull data, this information will be expanded. I do want to give a shout out to our school boards, though, and our teachers, our students, our families. It was very encouraging to see our students from Hamilton's public and Catholic boards returning to in-school learning yesterday. We all know how critical in-school learning is for the mental and emotional well-being of our kids, and indeed for their development and for that sense of routine. So I want to thank all of our partners at the Hamilton Wentworth District School Board and the Hamilton Wentworth Catholic District School Board. They have been working tirelessly to ensure the enhanced health and safety requirements were in place to help safeguard students, educators, other school staff, and of course, all of our community. When it comes to returning to school, in-school learning, there isn't a single measure that is used to make that determination, but we do know that what happens in schools reflects what is happening in the community around them when it comes to COVID-19. And so with our case numbers coming down, our capacity to support case and contact management improving, our testing capacity functioning effectively, we did agree with the sentiment that schools should be the first thing to reopen for the health of our kids. And so we'll continue to work with our school board partners over the coming weeks and months to support those enhanced health and safety measures, to investigate the cases that inevitably will happen in the schools and work with them around dismissing cohorts and investigating to ensure we're identifying any cases and other concerns as we go forward. That's it from me, Mr. Mayor.
Thank you very much, Doctor. And just to reinforce the message that we want to thank everyone that's doing the right thing out there in terms of ensuring that they're staying within their own household and keeping their distance and wearing the mask and all the other recommendations. So thank you. Without your effort, we wouldn't be seeing those numbers go down, and we want to continue on that trend. If you are looking to shop locally, you can do that very significantly by joining the hometownhub.ca. That's very available to you, sponsored by the Chamber of Commerce and the City of Hamilton's Economic Development Department. Lots of stores are registered to do your curbside pickup and deliveries. So please, as much as you can, support your local businesses, all of whom are quite challenged right now, as you well know, as well as our restaurants. And so I do hope that you're taking advantage of Valentine's Day and shopping local there, and maybe getting your favorite meal from your favorite local restaurant. I'm sure they're all ready and willing and able to provide, and whatever you can do to help support them would be fantastic. So please do your best, and certainly enjoy Valentine's Day. To those residents who are doing their part, staying at home, again, thank you. And we know that's a struggle out there. For many people, it's even more of a struggle. So if you're struggling and you need help and assistance, you can call COAST at 905-972-8338, or the Kids Help phone line at 1-800-668-6868. It's okay to not be okay. And you know what? The anxiety and economic challenges and stay at home, work that we need to do can be very isolating, and certainly can be also mentally challenging. So do avail yourself of some support. You can also go to the hamilton.ca/COVID mental health website for additional assistance or direction in terms of how you can get help and assistance there as well. So folks out there, don't give up. We are doing as much as we can to prevent the spread of this virus. We can and we will overcome this virus in 2021. So stick with it, and we will now turn it over to Jasmine for some questions from the media. Jasmine.
Great, thank you, Mr. Mayor. We have 9 media joining us today. We'll start with one question and one follow-up for everyone. And just a friendly reminder that questions during the briefing this afternoon should be related to the COVID-19 response. Our first question will be to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi, thanks very much for taking my question. This would be for, I suppose, Dr. Richardson. You did mention that there's some concern that it's a little early to move back into the provincial response framework. Considering our numbers, they've come down, but they're still pretty high. Do you have I'm not sure how much power you have as the local medical officer of health to kind of impose additional restrictions that would still kind of keep us in line with this current level of lockdown? Like, how much power do you have to kind of keep things at this level as much as possible, given the province's decision?
Thanks, Lisa. And it's absolutely a matter where we're going to be tracking the numbers and seeing what's happening. And we do know there's parts of the province where their numbers are well down, and for them, this does make it's understandable in terms of their numbers about them emerging back into it. For us, it's a little bit closer. We're not quite Toronto, York, and Peel, but we're certainly not like Kingston is as of this week. So when it comes to the discussions, we'll be talking these things through, understanding the perspectives of our colleagues at the provincial level, but also looking at, are there specific circumstances, as we've done throughout this pandemic, looking at whether there's specific circumstances, specific things that are happening here where local direction would make a difference in terms of the control measures. So we'll look at that over the course of the week, continue to talk about it with our colleagues around the province as we do in terms of what they've seen and what's effective, and make a decision about whether anything's more is needed later on in the week.
Okay, thanks very much. And obviously the other concern is the variants that, we're seeing in other neighboring communities. Thankfully, we haven't seen it yet in Hamilton. How concerned are you about it, inevitably potentially cropping up in Hamilton?
Well, I think when it comes to the variant, once we're at the point where we have community-acquired cases of the variant, and Public Health Ontario made that decision at least a week ago now that they, or made that, gave us that advice in terms of what they were seeing, the consultations they were having, that was definitely going on. So I think it's just a matter of time in terms of when it's going to arrive. I don't think there's a way that any part of us is going to keep it out entirely, but it is very much a case where we can do a lot to manage it when it happens. And we as a community, just as we've done throughout, can make a difference in terms of our behavior and what we choose to do. And so if we are not following through on public health measures in terms of advice, and that's certainly what we were seeing as the case numbers were increasing, when we have a more transmissible virus, then that's going to happen all the quicker here in Hamilton or elsewhere. So we do need to continue to be very vigilant as we go forward, both through the remainder of this week, but as we go forward beyond it as well.
Thanks, Dr. Richardson. Next question is to Kate McCullough from the Hamilton Spectator. Kate, you can go ahead.
Hi, everyone. Thanks very much for taking my question, which is also for Dr. Richardson. I just wanted to circle back on asymptomatic testing in schools. Last week, you said that that was something that you were discussing with Hamilton school boards. And I wonder what those conversations have yielded at this point, and what details you can provide around how targeted asymptomatic testing might be used in Hamilton schools now that students are back.
Thanks, Kate. Yes, we continue to have those discussions as we move forward and look at it's the Ministry of Education who's in fact contracted the service provider who might do that. And so we have to speak with them as well to see what they're capable of doing. And so we're looking at how that might help us in terms of investigations when we're looking at cases, when there's cohorts that are dismissed, we're looking at where it might help us from that perspective, and then looking at whether there's other applications of it. I know the Ministry of Education is also looking at this, and so I think it's a pretty dynamic discussion as we go forward.
Thanks. There also seem to be a lot of mixed views on the efficacy of asymptomatic testing in schools, with some saying that it's maybe not the best use of resources because they could yield false positive from people who may not be contagious but have remnants of the virus in their systems. I just wonder if you could share with us your opinion on targeted asymptomatic testing and what maybe we can learn about transmission among students and staff from this kind of testing.
Yeah, thanks, Kate. There definitely has been some, very active discussion about the role of these tests. And, we know that they've been rolled out in different ways by the province in terms of doing some targeted testing in workplaces and looking at their use in long-term care homes. And we understand their attractiveness in terms of turning results around quite quickly. And so, that's a reason why people would like to use them as well. They've now just been approved to use a nasal swab instead, which while it makes it easier to do, if anybody's had an NP swab before, a nasopharyngeal swab before, you'll know why people don't like to have those very often. But at the same time, the test doesn't perform quite as well when you don't get that same quality sample. So there are concerns that the test's characteristics are such that it doesn't do a great job of picking up all of the potential cases, nor does it do a good job of being very specific about what it is that it's picking up. So you get a lot of false negatives, false positives. And so that especially is a problem where you have a low level of virus circulating, is where we're seeing our levels drop now. So when we're looking at these tests, really there's two different kinds that are out there. There is one that's called ID Now, which is a different type of test, which does work a little better, and that they are using up north, where getting to testing, any sort of quick turnaround in testing is very difficult. And so it does give you something to use in outbreaks and case investigations on a much more timely basis. The kinds of testing that we're talking about in the schools and whatnot are these rapid antigen tests. And these are the ones where really, from my perspective, it's of more use where you can use it in a group that's not otherwise going to get tested. So if you have people who are having a difficult time accessing testing, then that might be where you would bring those tests to them. But it should never be a replacement for diagnostic testing, for testing of somebody who's symptomatic. That absolutely should not be the case. We need to use the gold standard test that is out there through the assessment centers in those situations. So that's primarily where we're looking at using it in terms of helping us understand transmission in schools. It might help us where we're able to screen a few more kids in the case of those dismissed cohorts. And that's where we're looking closely with some of our colleagues who are ID specialists and medical microbiologists to say, could this help us a little bit further to understand that? And we're just still working those things out.
Thank you, Dr. Richardson. Next question is to Jeff Gray from the Globe and Mail. Jeff, you can go ahead. Just check back in with you one more time, Jeff. If you'd like a question, you can go ahead. Okay, we'll move next to Maria from the Hamilton Spectator. I'm going to read Maria's questions for today, both to you, Dr. Richardson. The first question, recent inspection reports at Macassa Lodge and the Meadows long-term care show continued problems with cleaning and infection control within homes. We saw similar issues in the inspections at Grace Villa. Can you comment on how frequently these issues are turning up in inspections across homes in the city?
Hi there. Thanks for doing that, Jazz for Maria. Unfortunately, I don't have those details at hand for us. That's something we'd have to do in a different setting and get back to her and look at that data as a whole.
Okay, I will ask her second question as well. Can you comment on why inspections are still finding these issues so late in the pandemic, and what homes that aren't in outbreak should be doing right now to prepare?
Yeah, so I mean, and it does relate in part to what her first question is. Certainly, we know that they've been having a very difficult time with health human resources right across the system. And so at the homes, long-term care homes and retirement homes, especially when we are seeing homes that are in outbreak, and you've heard me talk about how they need 2-3 times as many staff they find during those times in order to both provide care, because the care needs go up, but also to do all of the IPAC measures that are required, the cleaning, and those sorts of things. And it's been hard to find staff. It's been very challenging. People have worked very hard across the system, shared staff, and all of those sorts of things. So these things do unfortunately continue to happen. And as the pressures don't go away in the system, we don't have a whole lot of staff waiting around to staff these facilities when these things happen. And so monitoring it, making sure that they're staffed to the level they can is very important. The other thing that we've seen with this, you've heard me say this as well before, is, and you've heard Paul talk about it in relation to us all going forward, is we're really talking about adherence to these measures that is really near perfect. It's hard to do that. It's hard in any circumstance to do that. To have everybody do it exactly right all the time is challenging. And so we do continue to see some level of those deficiencies. A lot of our numbers, though, are very, very high, and we've certainly seen that with our colleagues at McMaster, Macassa, where they have had very high rates on their compliance audits that I've seen just as recently as today. And so we continue to watch that, continue to stress those things, and that's all part of bringing it back under control.
Great, thank you, Dr. Richardson. Next question will be to Matt Ingram from CHCH. Matt, you can go ahead.
Thanks so much for taking my question. It's also for Dr. Richardson. You did say that it seems quick to get back to this framework. Do you think Hamilton isn't ready to come out of lockdown?
Matt, it's a hard one to say today. I think, as I look at the numbers and where we're at, I certainly think we need to have some significant controls that continue to be in place. We're certainly, just getting back, as I said, with schools and what we're going to see on that front. I'd like to see what happens with the variant over the coming few weeks. I'm quite concerned on that front and what it's going to mean for all of us, not just for Hamilton. And so, over this week, we're certainly going to be looking at those numbers, having that discussion, and then ultimately it's in the province's hands as to which way they decide to go.
Thanks so much. My follow-up is also for you, Dr. Richardson. You're very popular at this press conference, as usual. So Dr. Williams and Minister Lecce have said many times that all medical officers of health in the province were consulted and approved of the school reopening plan. There have been reports that some medical officers in some parts of the province are not in full agreement with that statement. I wanted to know, how much time was spent consulting with you before the school reopening plan was presented?
So I think, we have to recognize that the plans themselves are always the province's documents. And so they're developed by them, and they come out and consult with us on issues and on aspects of the plan. So that has been my experience throughout this. And that there are tables particularly set up to do a lot of that work, working groups at the provincial level that oftentimes have public health people who are on those tables. And so I can't speak to the degree of consultation that happens in that setting per se. I can tell you that before the reopening, absolutely, Minister Lecce himself did reach out to talk about, how did we feel about where things were at? What was my opinion in terms of moving forward? And as you've heard me say many times, when it comes to school reopening, that we very much agree with the sentiments that are put out by our Sick Kids colleagues about, last to close and first to reopen, that this is something that is important for our children's mental health, our children's academics and development. And so we're very supportive of them reopening at this stage.
Thank you.
Thanks, Dr. Richardson. Next question will be to Bobby from CBC Hamilton. Bobby, you can go ahead.
Hello, I hope everyone's having a great day today. My first question is for Dr. Richardson. You mentioned that contact management testing and tracing rather is kind of restarting in full force now. And I just wonder, since we had a lack of that over the last month because of all of these cases, how has that impacted the information and statistics we've been seeing? I mean, could the situation be worse than we realize right now because we couldn't do that contact management and tracing?
So in terms of its role in the management of COVID-19, there's no doubt that it makes a difference when we can't do everything as we go forward, that we're not able to contact people in as timely a way, help to educate them, help to get them the support. A lot of what our case management staff do is to help them, help people be able to stay at home when they're either isolated or in quarantine. And the supports that they get from our own social services within the city and from others across the city in order to do that, whether that's getting food or their medications or whatever it may be. So there's no doubt that that is a challenge as well from an information perspective. No, you're quite right, Bobby. When we're not able to keep up, we don't have the timeliness of information that we would otherwise have. And you will have seen that in some of the qualifiers that we've put into some of the data over time. That we are not able to have everything as fulsomely as we would like.
Thank you. And my second question is, now that we do have full contact management, I wonder when will public health restart collecting race-based data and data on vulnerable populations?
Yeah, thanks, Bobby, for raising that, because it's certainly one of the things on our mind as we were stepping back through this framework that we had put forward about, here's the things that we're going to do and that we're going to have to stop doing as we were not able to do full case and contact management. One of the things we did have to stop doing was collecting that extra data, and we were just at the point of discussing resuming that collection if we were able. We've been now able to get to the people. Now could we add more time back into the processes, which would have allowed us to collect that data? But if we are at a point where we may see cases go back up, I don't know that we want to start for a day or two and then have an inability to do that. So again, that's something that over the next little while we'll look at and make decisions about when we're able to restart. I mean, the reality is that we know a lot of this information from the case data collection that we've already done, and that places not only around Ontario have done, but across Canada and beyond. And very much the patterns are there and well understood. The people who are most vulnerable are those who have been most affected. And I have no doubt that that continues to be the case. And that's why the supports that are put in place, that's why as we're reaching out with our vaccine strategy, we're reaching out to these communities to ask them how we can help them to understand about the vaccine, to understand how we can support them to be vaccinated, because we know that getting that vaccine out to them is going to be critical as well.
Thank you.
Thanks, Dr. Richardson. Next question is to Dawn Mitchell from CHML. Dawn, you can go ahead. And I will just try one more time. Dawn, if you'd like a question, you can go ahead.
I guess it's that mute button again. Thanks, everybody, for taking my questions. I appreciate your time. First question is for Dr. Richardson, and I want to circle back to asymptomatic testing in students. You hinted that you're looking at potentially, I guess, a third party, I guess is how you described it, to potentially do the testing. I've been in touch with some of the northern regions, which have already started their school years, obviously several weeks in advance, and some of them are doing their asymptomatic testing as of now by necessity because they've had some outbreaks. I want to know, do you have any idea, like step by step, how you think this is actually going to roll out?
Hi, Don. Yeah, the vendor is definitely that of the Ministry of Education. It is it's the ministry that is contracted with that group. And in terms of exactly how it's going to roll out, as I said, we are interested in bringing it to groups that have not otherwise got access to testing and helping us to understand when we are dismissing cohorts. And then the specifics of that, we're still trying to work out with the vendor around what they can do, what their capacity is. We know that they only have a certain capacity for the entire province. That's our understanding. And so we are still trying to work that through with the Board of Ed and with the vendor, Boards of Ed.
Okay, follow up. I'm just going to
Go ahead.
next one over to Paul Johnson, just because he seems kind of lonely over there. Well, as does the mayor too. But yeah, so for Paul, I just wanted to say that it looks like in terms of like enforcement of businesses over the last week, there wasn't really anything to tell. The province has told me that despite some of the lightening and restrictions in some areas over the province, they will not be stopping their blitzes. They will continue. Do you see the same thing for the city in terms of enforcement over the next little while?
Oh, 100%. Our enforcement, our prioritization of our municipal law enforcement folks remains with COVID and any other health and safety related enforcement that they need to do. And that's not going to change. And as things are relaxed, particularly in these early stages, the enforcement to what is allowed is really important. And it's helping to find the things that make a difference. And, for businesses that, unfortunately aren't following the rules. Now we're able to highlight what that looks like, and other businesses recognize what's there. And I will say that the other piece is it's an important check-in point for us with businesses who are following the rules and doing things. For us to hear how things are going and to check in. So there's always that communication that happens. For those that are doing things well, we get to check in and see how they're doing. For those that aren't, we get to recognize the importance of enforcement. But I will say what's continuing to be a challenge for us, and it will be a challenge as we move forward, is the number of people that are holding private gatherings. And even if we move into a level where there's some level of that's available, it just can't be back to the level that people were experiencing a year or two ago. And that's going to be in place for a while. And the pent up energy and excitement of coming out and celebrating has to be tempered by the fact that is a long way into our future. And so absolutely for the next period of time, enforcement of all of our local bylaws as well as the provincial reopening regime will be, as I say, a priority for our municipal law enforcement folks.
Thank you, Paul. Next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. My questions are for Dr. Richardson. Dr. Richardson, if you feel that it might be a bit too soon to lift the stay-at-home order, is it possible that we could stay in the stay-at-home order a little bit longer, the same way Toronto, York, and Peel are staying in for an extra week? And are you advocating for that?
Thanks, Joanna. At this point, we're really looking at the numbers and where we sit and looking at how things unfold over the coming week. So ultimately, this is going to be a decision that the province makes. We're certainly, as you've heard me said, I would be looking at something on the more conservative side rather than than going forward gung ho. But we'll look at it and give input where we can and discuss it with our colleagues and hear their perspectives, and they'll hear ours, and the province will make their decision at the end of the week.
Okay, thanks so much. And I know the province ultimately decides, what color in the framework we are going to end up in. But is there a color that you would like to see us end up in, Dr. Richardson, or colors that you don't want to make sure that we are not in?
Oh, not at this point, Joanna. Again, it comes down to the numbers and getting to spend more time with our colleagues and understand where they're coming from, what they're seeing, what they're hearing across the province. And, we'll see where we're at by the end of the week.
Great. Thank you, Dr. Richardson. Next question is to Desmond from CBC Hamilton. Desmond, you can go ahead.
Thank you. It's a question for, can you hear me?
Yeah, we can hear you. Go ahead.
Okay, sorry about it. It's a question for Dr. Richardson. Is there a reason why no new vaccinations were administered between the end of day Sunday and yesterday?
So Desmond, I don't have exactly when we were out in the mobile clinics in detail in my head right at the moment, but essentially I can tell you there's two things. One is at the fixed site, the provincial direction was to extend all those who were staff and essential caregivers to extend the second doses out to the 35 to 42 week point. So that's why the fixed site has not been vaccinating. And then for our mobile site, which is our staff and partners that are going out to vaccinate in the long-term care homes and high-risk retirement homes, they have to do those vaccines within a specific interval. And so they are doing those second dose clinics and then catching up if there are people who weren't able to get the first dose. So it's at this point, it's all very much a timed thing and relates to what was done in the first set of clinics.
Thank you. Regarding outbreaks, are there situations where the number of cases would be lower one day than the previous day?
So I'm not sure, Desmond, if you're referring to the overall number of outbreaks.
The overall number of cases in a particular outbreak.
Sure. So when it comes to outbreaks, again, with each case, we go through and do verification around that case to understand how it fits in with the outbreak. So at times there's been a misunderstanding, and for example, about when a staff person has worked, and so they may not be associated with that outbreak after all. There are occasionally still tests that occur in that circumstance where we're doing frequent testing during outbreaks where positives even then are identified as false positive tests. And so there are circumstances where the numbers will go down in an outbreak setting as well.
Thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today, so I will pass things back to you.
Great. Thank you, Jasmine, and thank you to our media partners for all of your great questions. And Bill Custers and the entire team at Cable 14 and Clear Cable always do a fantastic job of making sure that these availabilities run smoothly. So thank you to both of those individuals and organizations. And if you are looking for any additional information on COVID-19, whether it's vaccine information or you know, what some of the rules and regs are, you can go to hamilton.ca/coronavirus. That's an awful lot of information is on that particular site, should you have internet access and availability of that. And if you haven't done so already, please do download the COVID Alert app on your smartphone through the App Store or through Google Play. It is a very, very helpful tool to help one understand if you've been in contact with anyone that has been in contact with COVID. So whatever you can do would be very helpful in terms of downloading the COVID Alert app. Our next availability and media briefings will take place on Tuesday at 4 p.m. Next Tuesday at 4 p.m. In March, we will return to our regular time slot at Mondays at 3 p.m. And our next media briefing will be on Tuesday, February the 16th at 4 p.m. Thank you all for tuning in, and thank you for that continued good work out there in the broader community. And let's keep at it, and we will continue to work hard collectively to overcome this very unfortunate but challenging virus. Thank you all very much, and we'll see you at our next media advisory. Thank you.